Heart attack cases are increasing among the doctors even more than the common public. So more bothering thing is that even the so-called the experts, that is the cardiologist as well as the cardiac surgeons, even they are suffering from this heart attack. Recently, that is a day before yesterday, in Chennai, there was a cardiac surgeon by name Dr. Gradlin Roy, was aged around 39 years. He suffered chest pain, that is a chest discomfort, when he was doing rounds in his hospital. So immediately he collapsed. He was attended by his colleagues. So almost all of them are cardiologists. They attended him, they treated him. So almost all the procedures were done, like a CPR, stent, aortic ballooning. Every possible treatment was given to him. Still, they couldn't save him. So this is the fate of a cardiologist or cardiac surgeon. Then what about the common people? Any common person, if he is suffering from any health issues, what he will do? He will consult a doctor, thinking that the doctors know about health, he will get cured of his disease. If the patient is suffering from any heart-related issues, then he will consult a cardiologist. So this cardiologist, with what expectation? The cardiologist will be knowing everything about heart. So consulting a cardiologist, I will be saved of this heart attack. With that expectation, the common people will approach the doctors. But what's happening here? A 39 years old doctor, that a cardiologist, cardiac surgeon, who knows everything about the heart and heart diseases, knows about the heart, what are the investigations, what are the tests to be done, then knows about the treatment for heart diseases, knows about the medicine for heart disease as well as the surgical intervention. Everything he knows about the heart disease, but he couldn't save himself. So what is the reason? What is the reason for this heart attack? That too, especially among the doctors. So after these incidences, many doctors have said that heart attack among the doctors is more because of more stress. Doctors will be having more stress, more work, more workload, as well as disturbed sleep. But my question is, the IT workers, that is the software workers, they will be having more workload, they will be having their target for their work, they will be having the night shift. So more stress will be there among them compared to the doctors. Not only the IT workers, even the businessmen will be having more stress. In my opinion, doctors will be having less stress compared to any other professionals. Then what is the reason, what is the cause for this heart attack among the doctors, among the cardiologists? In my opinion, there are three things. So first is not having the health knowledge. Doctors will be having the disease knowledge. How the people get the disease, what is the cause, then what is the treatment, everything they will be knowing about the disease, but they don't have the health knowledge. That is not being a thought in the medical profession. So with this disease knowledge, what they will do? They will be having the fear of a disease. So immediately they start medications, self-medication. Disease knowledge, so like diabetes, hypertension, cholesterol, risk factors for heart attack. So like this, they test their blood sugar level. If it is little bit more also, they start early medications. Even for hypertension, if his blood pressure is little more, they start medications. And even the cholesterol also, they start medications. They check themselves and start medication, early medications. Instead of curing the disease, instead of reversing the disease, they start medications. In my opinion, it is not the disease which is killing us, but it is the medication, unnecessary, unwanted medications which is killing us. Second thing is fear of disease. For example, in Corona, so many doctors died. And everybody think that they died because they treated a Corona patient and they suffered Corona and died because of that. But actually, death of a doctor in Corona was not because of the disease, but because of the fear. Every day they were seeing many patients dying due to this Corona. So that fear itself killed the doctors. So like that, even in heart attack also, especially the cardiologist will be treating the patients, heart patients. They will be seeing many patients dying because of heart attack, even without any risk factors. When they see 20 or 25 years old persons dying of heart attack without any risk factors, again the doctors will be having, especially the cardiologist will be having more fear. That fear, that is the fear of disease as well as the fear of death, is killing the doctors. Third cause is dietary imbalance. So what is this dietary imbalance? So generally we keep listening that we need to have more protein, we need to reduce our carbohydrate. We keep blaming the carbohydrate. Carbohydrate is the source of energy. It is the most essential thing which our body cells need. Still we keep blaming the carbohydrate and saying that we need to replace this carbohydrate with the proteins. See, even the nutritionist, dietitianist, they keep telling you to increase the protein level. Actually, we need 2 to 5% of a protein. So total food, whatever we consume, out of that only 2 to 5% should be the protein. But what we are doing, we are increasing this protein level to 20 to 30%. Generally, it is being advised to consume more protein in the form of either non-vegetarian food or with more eggs, with more milk, as well as with sprouted grains. So these sprouted grains are also having more proteins. When we consume more protein diet and increase our blood protein level, that will affect our heart in two ways. So one is protein being more acidic compared to other nutrients. This protein is highly acidic. So this acidic protein, it damages the endothelial cells of our vessels. So when it damages the endothelial cells, so when more protein is there in our blood, it is somewhat like acid is circulating in our blood. This acidic blood, it damages the endothelial cells. So this damaged, diseased endothelial cells allow easy deposition of this cholesterol, resulting in narrowing of the blood vessels and heart attack. One thing. Second way is that protein is being thick compared to carbohydrates. The protein is thick, and this thick protein causes blood clots. Protein causes heart attack in two ways. One is being acidic, second it is being more thicker. Then what are we supposed to do? Not just the doctors, even the common public will have this question. So first thing is, we need to know what is the actual cause of this heart attack. We need to stop going behind these traditional risk factors which are being blamed for the past 7 years, like hypertension, diabetes, cholesterol, familial risk factors, all those things. Even without them, heart attack is happening. So we need to stop going behind these risk factors and we need to find out what is the actual cause of heart attack. So main thing is we need to reduce the protein intake. Protein is the major cause of heart attack. So we need to reduce as much as possible. We need to reduce the protein intake. Second thing is reverse the disease. Don't control with the medications. Reverse any disease. Any disease can be reversed. Diabetes, hypertension, even cancer can be reversed. So reverse the disease instead of controlling the disease. The third thing is very important is, so take out the fear. Take out the fear of a disease as well as take out the fear of a death. If you need precise and scientific information about health, then only subscribe to our channel. Namaste.